team and I are here to talk about breast cancer. So breast cancer starts in your breast. It can start in a lot of different places in your breast, but the main ones are in the glands and ducts that make milk, and it can easily spread throughout your body. So here are some statistics for you. Breast cancer is the second leading cause of death for females in the United States, but it's the first leading cause of death for females ages 40 to 49. So that means 1 in 38 females are gonna die from breast cancer.
As you age, the risk of getting breast cancer increases. Additionally, about 25% of breast cancer cases are related to family history. Drinking excessive amounts of alcohol as well as having a high fatty diet may also be a contributing factor. Change in breast or nipple appearance, nipple tenderness or a lump near the breast, or nipple discharge.
It can be detected with regular screening tests that find cancer before you start to feel symptoms. The American Cancer Society recommends that women aged 45 to 54 get a mammogram every year, and self-examination is also encouraged.
Skin cancer is the most common type of cancer in the United States, affecting about 1 in 5 Americans by the age of 70. It is caused by abnormal growth of skin cells anywhere on the body, but it is usually very treatable if it is caught early.
Melanoma is the most serious form of skin cancer. They look like moles, but they can be detected early by remembering ABCDE. A is asymmetry. They are not symmetrical to one another. B is border. They tend to have uneven and irregular borders. C is color. They all have different colors. D is diameter. They tend to be a little bigger than the eraser at the back of the pencil. And E is evolution. They tend to change their size, color, and shape over time, and these are the ways to detect skin cancer early.
Some risk factors that increase your chances of getting skin cancer are a lighter natural skin color, skin that burns or reddens easily, blue or green eyes, blonde or red hair, a family history of skin cancer, and older age. Increased exposure to UV radiation from sunlight or tanning beds also are significant risk factors.
To prevent skin cancer, make sure you're avoiding the risk factors mentioned before. If you're spending an extended amount of time in the sun, make sure to wear sunscreen and long sleeves and pants, as they reduce the amount of UV radiation on the skin. If you find any skin abnormalities, make sure to call your doctor or dermatologist for counseling.
Colon cancer is a cancer that develops in the large intestine. Most colon cancers start off as growths in the inner lining of the colon, called polyps. However, not all growths turn into cancer. These growths are small and don't often produce symptoms. Colon cancer is the second leading cancer killer in the United States. Colon cancer targets patients 50 years old or older and can be found in both men and women.
There are a great deal of risk factors that can affect colon cancer. Some are preventable. For example, being overweight, having a poor diet, and not exercising regularly. However, some cannot be prevented. For example, being over the age of 50 and having a history of inflammatory bowel disease can also increase your chances of getting colon cancer.
As you know, colon cancer starts off as small growths called polyps. Not all of these growths turn into cancer. However, it is important to get screened for early detection and removal of these growths. Only 4 out of 10 patients catch these growths early on to stop the transition to cancer. When detected early, the survivor rate is about 90%. There are many ways to get tested for colon cancer, so speak to your primary doctor about your options.
Some preventable risk factors include maintaining a healthy body weight, watching your diet, and exercising regularly. Avoid consuming large amounts of red meats, and try eating more fruits and vegetables. Also, you can try limiting your alcohol consumption and quitting smoking. For those that are over the age of 50, should also try getting tested regularly for colon cancer.
The pancreas is responsible for helping your body break down food as well as producing hormones that regulate blood sugar levels. Pancreatic cancer occurs when abnormal cells grow and form tumors, although not all tumors are cancerous. It is mostly seen in both men and women over the age of 65 and is the 4th leading cause of cancer deaths in the United States.
Symptoms of pancreatic cancer include fatigue, weight loss, pain, diarrhea, and the yellowing of the skin. Although there are other conditions that may cause these symptoms, if you develop any of these symptoms, please contact your doctor directly, as there is no screening test for the general population.
There may be certain factors that increase the risk of pancreatic cancer, including diabetes, history of an inflamed pancreas, family history, obesity, and older age. If you smoke, quitting will help reduce your risk of cancer. In addition, maintaining a healthy weight, getting daily exercise, and choosing a healthy diet with fruits, vegetables, and whole grains will also help reduce the risk of pancreatic cancer.